So now we are going to turn to Catherine White, Director for Childcare and Early Learning at the National Women's Law Center. She's going to talk about the childcare system from the perspective of the workers. So Catherine, welcome, and looking forward to hearing from you.
Great, thanks so much, Chris. And again, I echo the thanks of the other panelists to the National Press Foundation for elevating this critical issue. Tyler, we can move a couple slides down to where the first text is, but before I sort of get into the history of the workforce, who these people are, going a little bit deeper than what Linda and Hannah were able to touch on, I just want to sort of leave folks with like 3 key takeaways that I think you've heard from all of us so far, but just to really hammer it in, which is first, childcare is a collective responsibility and a public good that benefits all of us. And as Hannah was specifically mentioning, that means we need to change the way we invest public dollars in our childcare system. And at the very core of the system are childcare workers, who are the backbone. They are essential for these businesses, as Linda was talking about, but they have been underpaid and undervalued even before this pandemic. And it's only getting worse with the added strain of COVID-19. So we can go to the next slide where I'm going to talk a little bit about the history of the childcare workforce. So you've heard all of us say this in some form, but childcare workers have always been essential to the functioning of our economy. And particularly when we think about what workers bring, they are essential for the high quality care that parents want and need. And we know that childcare is a tough job and it requires highly skilled educators to be doing this work. One thing I always like to do for folks is to really make this real to them. I don't have children, and sometimes folks ask me, why do you care about childcare workers? What about them benefits your life? And so one thing I encourage folks to do is think about who you see in your everyday life, even during the pandemic. People performing essential work like grocery store workers, a delivery driver, a construction worker, a doctor, a nurse. We know that 1/3 of workers have a child. So chances are the people you interact with on a daily basis can only show up and do their work because of childcare and because of childcare workers behind them. That said, as Linda was talking about, when we say childcare worker or childcare provider, it's not a monolith. You know, these folks are operating in vastly different settings, from licensed to unlicensed care, in centers that you might see like a brick and mortar building, or a family childcare home, as Linda was talking about, which is someone in the community operating a program for children out of their home. They could also be a family, friend, or neighbor who cares for children on a regular or sporadic basis, like a grandparent. And as Hannah and Linda both talked about, the childcare business model relies heavily on parent fees. So I just want to mention that operators usually have to rely on private pay, even if they're also getting some subsidy money. Yet despite being essential cornerstones of our community, of our economy, of how businesses function, childcare workers have been underpaid and undervalued precisely because of who is doing this work and has been for decades. As I think Linda mentioned, nearly all of childcare workers are women, and disproportionately women of color and immigrant women. And the history of childcare in the US is actually directly rooted in the exploitation of Black women, beginning with the institution of slavery, which forced Black women to nurse and care for children of white landowners. And even following the end of slavery, many people of color continued to do domestic work, including childcare, because it was one of the few occupations available to them. So for the workers in childcare, this undervaluing of their essential work meant they were economically insecure even before the pandemic hit. And if we can turn to the next slide, I'm going to talk a little bit about what this looks like in numbers. So the National Women's Law Center has done an analysis of the lowest paying jobs in the US, and we found that childcare is one of the 40 lowest paying jobs. For what is highly skilled and essential work, what are the lowest 40 paying jobs? And in spite of the prevalence of women of color in the field, that is even further stratified by race. A recent study found that Black and Latinx workers are more likely to be relegated to lower level positions within childcare programs, and Black educators are typically paid 78 cents less per hour than their white counterparts. So the gender and racial gaps that we see in earnings in other industries are also present in the childcare field. And as Linda mentioned, these workers typically make just over $11 an hour, and they lack benefits like healthcare, also paid leave, retirement benefits, things that they need to make this a real quality job. And that low pay leaves many childcare workers, about 1 in 7, living below the poverty line, including those that have children of their own, and they're unable to put food on the table for their own families, let alone afford childcare for their own children. For workers operating as providers, as Linda was talking about, so they're operating their own business, they've been operating on razor-thin margins because of the broken business model that Linda so helpfully went through. And that was before the pandemic hit. So all this to say, as Hannah and Linda were talking about, this is a really tenuous system even before the pandemic hit. So now going into what the pandemic has done, I just want to dive a little bit deeper into some of the data that I know Linda and Hannah touched on the next slide, which is sort of what happened to childcare providers, what happened to the workforce. So at the beginning of the pandemic, some childcare providers remained open to care for children of essential workers. Some closed because they were required to, or they opted to because it was safer for themselves and their workforce. Now, many providers are reopening, but they're concerned about how to make ends meet. They need to serve fewer children to comply with public health guidelines and social distancing, which means, as Linda was discussing, that they have less revenue coming in, and they already were barely making ends meet. They also, at the same time, have higher costs. And I want to talk about what some of these things are. They're cleaning and sanitation supplies, PPE for their workers, outfitting their facility to allow for safe entry and exit, finding and paying substitutes in the event a teacher gets sick, and more. In fact, the Center for American Progress did an analysis of how costs have been changing and found that costs for centers have risen an average of 47% as a result of the pandemic. Just let that sink in for a second. Many providers, as a result, they just cannot make the math work. They've said, we don't have enough revenue coming in and we have higher costs. This doesn't make sense for us anymore. And they have had to close permanently and lay off any staff that they employed. And so what we've seen from BLS data is that since February, about 1 in 5 or 1 in 6 childcare workers have lost their jobs. And as Hannah mentioned, this isn't the end. We know that more job loss and permanent business closures are coming. The NACCE survey that Hannah discussed talked about how 40% of the market is slated to leave if Congress doesn't act to provide the relief needed. And I would just add that about half of those folks are minority-owned businesses. So when we're talking about who this impacts, it is going to be Black and Brown communities most. And then to just hammer in something that Linda was talking about with the broken business model, because staffing is such a big cost, and because of the upfront and ongoing costs to maintain a childcare program, if these providers leave the market, we may never get them back. They could go and get paid more money to do less skilled, easier work in other industries. So if we lose them, we are going to lose them forever. We cannot just turn back on a childcare business the way you can, as Linda was mentioning, with a K-12 school. So if we go to the next slide, I just want to make this really real for folks. The National Women's Law Center, along with CLASP and many other partners, gathered stories from parents, providers, and educators about what this actually means. And there are 2 examples here that I really think illuminate what we've been seeing in the childcare workforce. The first is the perspective of Danielle. She works in childcare as an educator. She is part of a family where her boyfriend has lost income, and she's unsure of what her hours can be and what her income can be from her childcare provider that she works for because of the instability in the market. And then on the other hand, you have Tanya from Colorado, who's talking about serving a tiny fraction of the children she did before. She can't make ends meet, and she's going to have to close her business and move into a different field entirely. This is what it looks like every day in communities across the country. So going to the next slide, I just want to reemphasize what Hannah and Linda have mentioned, which is we cannot emerge from this crisis, let alone rebuild our economy without childcare. And as Hannah mentioned, what has been provided by Congress already has been helpful, but insufficient. It was only able to help a tiny fraction of childcare providers and their workers with a small amount of the cost that they've been incurring. And without the investment that we need from the federal government, there are going to be serious implications for all of us. As Hannah was talking about, for the parents who can't go to work, for children's health and well-being, for the businesses who rely on workers. But I specifically want to talk about what this means for women. Women are found at both sides of the childcare system, as the workers and often as the mothers. So if we do not have a childcare system to return to after this crisis, It is going to be the Black and brown women who work in childcare who will see their economic security decimated, and mothers who will have to drop out of the workforce or work fewer hours to take on caregiving responsibilities. And we are already starting to see the impacts of this childcare crisis on those larger trends. In September alone, BLS data shows that women are leaving the workforce at 4 times the rate of men. And we know from surveys that women are doing so because they are taking on the burden of caregiving and housework. We also know from other data from the Center for American Progress that this is true sort of across the age span of women, with even millennial mothers more than 3 times as likely as millennial fathers to report being unable to work due to a school or childcare closure. So I'll just wrap up by saying childcare workers have always been central and essential to the functioning of our economy. And that's true now more than ever in this pandemic and as we think about the future of our economy. But we risk not having a system to return to, let alone to build off of, unless Congress and the administration act to provide the relief needed and then to rebuild our system to be more equitable and more effective in the future.